Public Service Project Plan. Hello everyone. In our leadership seminar course at Rutgers University, we were all given the responsibility of creating a public service project plan. In this plan, we had to find an organization that helps with a public health related mission, and we were given the responsibility of helping this organization in some way. The organization we chose for this public service project plan is PATH. For over 40 years, PATH has been working globally to accelerate health equity so all people and communities can thrive. They are advisors and partner with public institutions, businesses, grassroots groups, and investors to solve the world's most pressing health challenges. PATH has various health areas it focuses on worldwide that impact people and communities around the world. Unfortunately, a lot of these issues are broad and complex and need to be addressed by a charity such as PATH that has the resources to conduct extensive research as well as provide treatment in these needy communities. Some areas that PATH focuses on are COVID-19, malaria, HIV and AIDS, maternal and newborn care, and epidemic preparedness.
PATH has been working to increase access to health interventions, improvement of care, and achievement of health equity. More than 1,400 people work in a total of 70 countries. It has expertise in global health security, vaccines and immunizations, data systems, surveillance, and diagnostics. With the COVID-19 outbreak, PATH is supporting the immediate response by expanding their existing work in order to help countries be ready for testing, surveillance, mitigate strategies, and solutions to help improve their health system. They also help countries to identify health system strengthening opportunities that can come to help solve long-term concerns. They support countries to rapidly improve their oxygen supply, their access to vaccines, and supply chains. Continuing on, PATH's capabilities in responding to the COVID-19 outbreak includes advocacy and policy, devices, diagnostics, digital and data, country support, epidemic preparedness, primary healthcare, disease control programs, and vaccines.
PATH's vision is a world without malaria where leaders have the resources and determination to eliminate it. Their objectives include creating vaccines, finding treatments, inventing faster diagnostic tools, piloting new approaches, and utilizing data to prevent and stop outbreaks. Their focus is on the prevention and management of outbreaks, and their approaches involve innovation, technology, research, and data utilization. The PATH Malaria Care Program aims to improve malaria case management in endemic countries by targeting healthcare workers and national malaria control programs. Key interventions include training healthcare workers on malaria diagnosis and treatment, providing access to quality diagnostic tools and medicines, and supporting implementation of malaria policies and guidelines. The impact of the Malaria Care Program is improved quality of malaria case management, increased access to diagnostic tools and treatment, and enhanced performance of national malaria control programs. The program is implemented by PATH in collaboration with national governments, global health partners, and local organizations. The PATH Malaria Program also includes the Malaria Test for Life Initiative, which is a quality assurance program designed to ensure that malaria diagnostic tests used by healthcare workers in the field produce accurate results. Overall, the goal of the Malaria Care Program is to enhance the performance of national malaria control programs and improve the quality of malaria case management, ultimately contributing to the elimination of malaria.
For the past 2 decades, PATH has worked to develop integrated responses to the HIV/AIDS epidemic. PATH has focused on uniting strategies, funding, and knowledge to fully utilize the available resources to eliminate HIV/AIDS from the fabric of global society as prevention and treatment techniques become more effective. PATH prioritizes advanced technologies for faster diagnosis, easier prevention, and better treatment, strengthen health systems to expand the reach of comprehensive HIV and AIDS programs, and engage communities and individuals individuals in dialogue, empowering women, addressing gender inequities, and encouraging healthier choices. By keeping the focus on the needs and rights of key populations, we can prevent new HIV infections and ensure those living with AIDS are not left behind. This is what PATH does.
PATH helps multiple countries build strong healthcare systems completed with labs, information systems, clinics, and trained personnel. This trained staff is well equipped to prevent, detect, and stop disease outbreaks before they become epidemics or pandemics. There are over 50 articles posted by PATH that highlight some of the ground they have covered in relation to epidemic preparedness.
For maternal and newborn mortality, PATH has created easy-to-use technologies that will help women in the labor and delivery process to prevent maternal and newborn mortalities and any harmful health complications. They globally advocate for the priority of women and newborns and provide education to communities on how to care for and protect moms and babies before, during, and after birth. Some instances of what PATH has done for maternal and newborn assistance is that they are helping women in Kenya by advancing life-saving interventions for postpartum hemorrhage. They also have the Advancing Maternal Immunization Initiative, which is a collaboration between the World Health Organization and PATH to get as many pregnant women vaccinated as possible. This way they are protecting themselves from diseases, but also passing the immunity and antibodies to their baby. So this will protect the newborn babies for the first few months of their lives. And one of the vaccines that they're helping women to get is the RSV vaccine, which is respiratory syncytial virus. Another resource that PATH has is the Center for Vaccine Innovation and Access, which is the CVIA. And they also have the Maternal, Newborn, Child Health and Nutrition Program. These two programs help women get vaccinated. And PATH also has the Primary Healthcare Program, which is the most basic package of essential health services and products, and it serves as an entry point for women who need reproduction resources and support during their pregnancy.
If you are considering donating to this cause, please click on the GoFundMe link that's attached. Thank you in advance. If possible, we have also attached an anonymous survey below that helps us help more organizations such as PATH in the future. Thank you for your time.